Hi, everyone. My name is Dr. Gary Glassman, but you can call me Gary, or that guy who's oddly excited about doing root canals all day long. Welcome to another episode of Dental Talk, where we drill into the hot topics of dentistry. Pun is absolutely intended. Today, we are venturing into uncharted territory, folks, for the first time ever. We have a guest who's never wielded a dental drill or battled a stubborn wisdom tooth or tried to get around a calcified root canal. We're diving deep into the world of professional liability with Julian Perez, our legal eagle and first non-dentist to brave our dental-centric airwaves. Now, you might be thinking, Gary, why are we talking about liability? Well, let me tell you, even the best of us, yes, even those who can perform a perfect crown preparation blindfolded or get around those curved root canals without looking, we all run the risk of facing liability issues during our careers. It's like that one patient who swears that they floss daily, but has more plaque than the British Museum. It's bound to happen sooner or later. So whether you're a fresh-faced graduate, still paying off those expensive student loans, or a seasoned pro who remembers when digital referred to fingers, this episode is for you. So let's get ready to explore the wild world of professional liability, where the stakes are high and the lawsuits are even higher. I want to introduce my guest, Mr. Julian Perez. Julian is our Chief Legal Officer at Dentalcorp. He oversees our legal, regulatory compliance, and enterprise risk management functions. He's a graduate of Yale University and Columbia Law School. He began his career at a leading international law firm. But before joining Dentalcorp, he managed various functions with Canada's largest dental regulator, including dental malpractice defense, misconduct complaints, and investigations. His unique background bridges the gap between legal expertise and practical dental industry knowledge. Julian, welcome to Dental Talk.
Gary, thank you so much for having me. I'm really excited to spend some time with you talking about risk management, some compliance issues, and professional liability. Hopefully provide some tips for all the dentists out there who are watching. Will help you in your own careers and your day-to-day management of practice.
We are very fortunate, Julie, to have you and your team in our network. And as I mentioned, we're all get that fear when we get that letter from our regulatory body about a possible complaint. And it's nice to know, it's very calming. It's very nice to know that you have our back and help us guide us through that process, which can be, quite traumatic, especially if you're a new dentist.
Oh, absolutely. And it's so stressful, in fact, that I know, having worked at the regulatory body and in professional liability at doing malpractice defense, some dentists, what they do is they take that letter and they shove it in a drawer and forget about it, which is understandable, but it's probably the worst thing you can do. If that ever happens to you, my recommendation is take a deep breath, maybe take a 15-minute walk, go back, open the letter, read it, and then reach out to somebody who can support you.
It's that deep breath that's really, really important. What's the most important thing that dentists should know about professional liability?
I mean, first and foremost, it's a requirement to have malpractice insurance for dentists, for all healthcare professionals, for hygienists as well. And so in some of the provinces, that comes part and parcel when you register with your professional body and get your license. It's that case. That's the case in Ontario, Alberta, Quebec. In other provinces, you have to actually go out and purchase your own malpractice insurance, and there's different products out there that offer different services, different policies. But having that should give you a sense of ease, and that from a financial perspective, your exposure is a lot lower. But there's still a lot of stress whenever you have to deal with a dissatisfied patient or an outcome that's not what you hoped it would be.
And having that peace of mind is of utmost importance. It's not only for those that are new graduates, but even for me who've been out for 40 years.
No, peace of mind is everything. Sometimes, there's the ostrich effect where you want to deny that anything is happening. And I think you go through the 7 stages of denial like that. But look, if you have a complaint, if there's an unhappy patient, if there's a lawsuit, you still need to, leave your lunch break, go out and treat your next patient. And if your mind is elsewhere and if you're anxious, you won't perform at your best. And so, you have to learn to compartmentalize. Obviously, there's a lot of things you can do to reduce the likelihood that there will be a complaint. But you're right. If you practice long enough, dentistry is difficult. Dental specialties are difficult. The margin for error is really small. You're dealing with patients who are often in pain, who are unhappy, who are paying out of pocket sometimes expensive fees, and you can't save every tooth. And so even in the best of all possible worlds and the consummate professional, you could still have one of these issues arise during your career, and you probably will.
What I found in my own practice and working for over 40 years is the ability to manage patient expectations right from the get-go. When patients come in and you treatment plan and you recommend a certain treatment plan, you give them the alternatives, but you also make sure that they understand that we're working on human bodies and not everything works 100% of the time. 100%. And there really are no guarantees in life, unfortunately. So how do we manage that with patients from a compliance point of view?
I mean, we could definitely look at it from a compliance point of view, right? And I think the magical term there is informed consent. And that's also a requirement. Failing to get informed consent is considered negligence. There's two different ways you could be found negligent, right? One is the actual procedure that you provide doesn't meet the standard of care, and the other is that you didn't get adequate informed consent. I think the other lens to look at these things from is the human element, right? So you want to manage expectations. I think you hit the nail on the head with that. Patients understand that things can go wrong. They understand that dentists aren't magicians, but they also want to know what's going to happen. They want to know what the likely outcome is. They want to know what is the procedure going to entail. They want to know how they're going to feel during the procedure as well as afterwards. And if you orient the patient and you tell them, this is the diagnosis, this is what we're going to do, here's the equipment we're going to use and why we're using it, and then afterwards, your likelihood of success is X. And if you feel these symptoms, you should call back, or this is normal. If you orient the patient right there, the likelihood that they're going to be dissatisfied, they're going to complain, they're going to file a lawsuit plummets. It falls off a cliff because really what leads to patient upset is uncertainty, and also feeling like they weren't a part of their own decisions when it comes to making those decisions around healthcare.
When a patient complains, what percentage would you say are due to inadequate dentistry relative to miscommunication and not managing expectations properly from the get-go?
I mean, it's difficult to say, percentages, but what I will say is that they've done studies and shown that only 1% to 3% of negligence, right? So they've gone back, they've done chart reviews, they've interviewed dentists, they've interviewed patients, and they show 1% to 3% of negligence cases end up in a claim or a complaint. So that means 97% the patient accepts what happened. Maybe they ask for their chart and they go to another practice, right? Maybe they just grin and bear it. But I think the reason so many patients decide not to complain is because they felt like their provider did the best they could. They felt like their provider was honest, was transparent, was empathetic. And so through communication, you can eliminate, the vast majority. And we're literally talking 99% of potential litigation, even when the treatment doesn't go according to plan.
That's amazing. And that's something that those that are listening right now should really take to heart. Most of it is communication, soft skills with 100%. Your patients.
And from our very own University of Toronto, there was a social psychologist named Nalini Ambati, a real leader in her field, somebody we should be proud of. That she's a Torontonian and Canadian. She did a study where all they did was they listened to 10-second recordings of surgeons talking to patients, and you can draw a direct correlation to dentistry. And what they rated these 10-second audio clips on was just the tone of voice of the dentist. And so, of the surgeon. So when the healthcare provider was caring, empathetic, even expressed a little bit of anxiety or laughed, they were far less likely to be sued or to have a regulatory complaint. And they would look at these professionals' history with their colleges and their malpractice histories, which they had access to. So on the flip side, when dentists were uncaring and they used a coding technique to discern for condescension. So if they sensed condescension in a surgeon's voice, they were 2 to 6 times more likely to be sued.
Wow.
And that's controlling for all the other variables like quality, procedure, technique, schooling, career, how many years they've been practicing. So tone of voice is probably, along with the other soft skills, communication, et cetera, is the number one indicator of whether you're going to have a complaint.
Very interesting. So as a young graduate or even a seasoned veteran in dentistry, if we want to improve our soft skills, can we take a program? Can we take a course?
Yeah.
Can we go online and learn how to communicate effectively with our patients?
Absolutely. There are a number of courses. We offer some through DC Institute on effective patient communication. There are several other organizations that offer courses on patient communication. There's companies, and this is mostly in the hospital space, but their entire service that they provide is they will simulate dentist-patient or doctor-patient interactions so that you can just practice talking to
role
patients.
playing.
Absolutely.
That's amazing. So help me understand. There's so many different types of insurance as you can get. Professional liability, there's CDSPI, there's CDPA. Can you explain the difference between the CDSPI and the CDPA and their roles in professional liability for us?
Yeah, I'll do my best. I actually worked for the professional liability program at the Royal College of Dental Surgeons of Ontario. The professional liability program provides malpractice insurance, right? So any lawsuit, a civil lawsuit, they will hire a dentist, they will settle the claims, they will defend you, they'll go to trial, and all of that's going to be covered by your insurance. So that's in Ontario. CDPA is the Canadian Dental Protective Association, right? So it's basically a joint fund where if you join as a member, you have access to all of their services. And some of those services include defending you in regulatory complaints, right? So
if a patient complains to the college, but not civilly, this is where you can get a lawyer with your insurance that you pay.
100%. Yeah, the CDPA will do that. And as well, they have really amazing, I know many of them personally, they have really amazing risk managers that work there. So people who have dealt with hundreds, if not thousands of patient complaints through their career, who have advised dentists how to prevent a complaint from becoming a formal complaint, right? And will support you if there is a formal complaint through the whole process of responding to it, providing your records, giving your version of the events that occurred, and going through the records and explaining what the treatment plan was, what your thinking was, the technique you used, and the outcome, and why the outcome maybe wasn't what you expected. So that's the CDPA, and they help with all kinds of risks that come up. So as I said, it could be clinical, but a patient might be complaining about advertising, or they might be complaining about a privacy breach, or they might be complaining about how they were treated at the front desk. Just in terms of
just anything, really.
Anything. But those you need to take them seriously, because if you don't, those are the kinds of things that can end up as a complaint later, right? And so you want to get in front of it, deal with it, talk to the patient, resolve it. And these risk managers are fantastic, and they'll help you navigate that.
In Ontario, the CDSPI,
CDPA.
The other one.
CDSPI.
CDSPI.
Yeah.
It's a certain amount of the insurance is included with your dues, but you can take extra insurance. Is that extra insurance worth it? Like, were patients gonna sue for $10 million and settle for $10 million, or is it good enough to have the insurance that comes along with your renewal of your license every year?
So, the answer is it depends. First of all, if we're talking in Ontario and a couple other provinces, it's included already. So you have a couple $1 million of protection. There are other provinces where it's not included in your registration with the college. And so in those, you have to actually go out. You have to purchase malpractice insurance. And CDSPI is one of the leading providers of that in Canada. And because of their, I think, 60 years of experience, they've been around for a long time. They're really experts in dealing with dental malpractice and getting those claims adjudicated and resolved efficiently. So your question about whether it makes sense to have excess insurance, I can give you a couple of facts that'll help people maybe form that decision for themselves. In the last 50 years, I think there have only been maybe 3 malpractice claims in dentistry that have exceeded $2 million in liability. So if you think we've got 25,000 or some odd dentists, and every year there are claims, the fact that only 2 or 3 have exceeded that limit, makes you wonder whether it's worth it. Now, if you're an oral surgeon or you're a pediatric dentist and you're treating patients regularly under general anesthesia, and there could be, those kinds of adverse events that might very rarely, but sometimes occur. Coming back to peace of mind, you might feel for a few $100s or a couple $1,000s, depending on the size of your practice, it's well worth sleeping at night. To know that regardless of worst case scenarios, you wouldn't at least financially be at
And
risk.
to have that reassurance for the CDSPI as well as CDPA to cover both those bases, I think would be really great. I have a question.
Mm-hmm.
What are the most common types of risks that dentists face?
So if we're categorizing the risks, I think the first we've sort of touched on are clinical misadventures, clinical adverse events. So both from a sort of your license perspective, if it goes to the college, goes to discipline, you could potentially lose your license or have it suspended.
Mm.
There's reputational risk, right? So, there have been some cases where patient complaints ended up becoming news stories. And so that can really hurt your practice, right? As well as, you don't want to have to deal with that just in your personal life, having your career follow you and haunt you that way. So, places where reputational risk can come up is, online Google ads, things like that, where people can start to pile on. Social media is another one where, influencers and things like that have attempted to tarnish professionals' reputations. So you've got reputational risk, you have the sort of the clinical side of things. Another area is around your relationships with staff, right? Dental offices can be very tight-knit, familial environments. And sometimes, you run the risk of blurring that line between a professional distance and professional relationships and
Right.
more familiar relationships. And those can result in, having staff turnover, having low staff engagement. That can be a real killer for a practice in terms of the practice's performance.
Not a great practice builder.
No, and sometimes the dentist can wear many hats, right? So with you're the leader often, the manager, the supervisor, the owner, the boss. You may also be the dentist if you're providing your team members with free dentistry. Now, if something goes wrong on the dental side of things, then that work relationship can also be jeopardized, and then you could become friends. And so you are having people, staff members over to your house. Maybe you're celebrating the holidays and having a few drinks. And so those kinds of things can lead to conflict at work. And so you just have to remember, as a professional, in all of your relationships, you have to maintain that professional distance.
It's probably not a good idea to blur those lines and to have certain boundaries with respect to staff.
It's very difficult to not blur the lines, and so you have to understand what the risk is, and it's good to have like a set of personal ethics as well as a professional understand what's the risk to you of having a boundaries complaint or something like that.
Sure.
Like I think it's worth mentioning in Ontario and a couple other provinces, if you were to have an intimate relationship with a patient, right, who's not your spouse, that would be categorized as sexual abuse, right? And so even if it's perfectly consensual, people objectively may look at it and say, there's nothing wrong with it. That's two adults. In the eyes of the regulator and the law, the black letter law, those relationships can be categorized as sexual abuse. And you may have had what seems to be an innocent relationship, but the headline could be, Dr. So-and-so convicted of sexual abuse by his regulator.
Right. Not a good thing to have.
Not a good thing.
Obviously. We live in a digital world right now.
Yeah.
And with AI, can you just touch on the emerging risks related to technology, ransomware, privacy breaches?
That's a huge one.
That type of thing. Perhaps you can elaborate on that.
Yeah, absolutely. Technology has enabled dentistry to go places it never has before, and the pace of change in technology is accelerating. But at the same time, we've become very dependent on our computers, on our software, on our equipment. And if something goes wrong, it can bring a clinic to a grinding halt. So, ransomware is something I think people are more and more familiar with. And, both at the college and in my current role, we've seen bad actors from other countries attempt to cripple an office. And the way they do that is they'll send a virus to the practice somehow. Often it comes in through email, and you would click on a link, and that link will download a virus, but you won't know that that happened. So you'll leave the office at the end of the day. Maybe it's a Friday. And it often happens on the weekends because the bad actors know the office is closed, so they have time to get in to manipulate the system. You'll come back on Monday. You'll go to log into the practice management system, and it'll say error, and then there'll be a ransom note saying you're going to have to pay us $100,000 if you ever want to get your patient charts back.
Wow.
So that is a real risk. The other thing that happens, and sometimes they go hand in hand, is the bad actor will get in. They'll take all of your records. They'll exfiltrate them out of the office, and then they'll say, we have 2,000 patients' medical histories.
Oh, boy.
And we'll publish them if you don't pay us this ransom. So, getting to the sort of solution phase of dealing with this risk, it's so important that everybody in the office understands the risks, is trained on avoiding the mistakes that can lead to exposure, and also that you've got really good security in the form of firewalls and different kinds of endpoint encryption.
Prevention is key.
Prevention is key. And, it's worth understanding that dental offices are a target. So, these threat actors out there, as they're known, understand that dentists have often some income that they can pay a ransom with. B, they have charts that have medical history that are very valuable and sensitive, and that dentists may wish to pay the ransom. And so you really do have to protect yourself. Starts with training, but also means making sure you have really good IT systems and IT advisors, and that you keep everything updated and are constantly taking steps forward to get ahead of the curve.
So a complaint comes in here at Dentalcorp and our network. We're fortunate. We have you. We have your compliance team to help us walk through. It's very, very reassuring. But for those dentists that don't have that luxury of having a compliance team by your side and having your back, what should a dentist do if, as soon as they receive a formal complaint, do they need to hire a lawyer right away? Walk us through the process for those that are listening that don't have the benefit of a Julian Perez.
Yeah. So again, I think the deep breath is really important.
Calming right away.
Calm yourself down. It's going to be okay. The second thing is read the materials that you received. There's probably going to be a deadline in there to respond. The complaint is going to have some information that may or may not be true, or may be partially true sometimes. The college or the regulatory body is going to request some information from you. So they're going to request your response, your charts, and then take a minute to reflect. The number one thing that leads to stress is a feeling of isolation, feeling like you don't have anybody on your side, being alone, not knowing who to talk to. So one is, if you're a member of the CDPA, if your insurance company covers your regulatory complaints and you can reach out to them, reach out to them. They're there to help you. They want to avoid this issue escalating. And so they are your advocates. A lot of times people feel afraid to reach out, even to the insurance company. They don't know, what is the insurance company really going to be there to defend me? Is it going to increase my premiums? All these kinds of things. The sooner you reach out to an advisor, the better. The other thing is, if you have a friend who's a dentist, call that friend. They may have gone through something before. If you're a young associate and you're in a practice with a dentist who's been around a little bit longer, reach out to them. Just being able to share, first of all, it gets rid of a lot of the stress, a lot of the shame. You're not alone. This has happened to other people.
I too have broken an instrument in a root canal. Yeah, it's not such a bad thing.
Exactly.
Disclose it to the patient, and all will be good.
Yeah. So no, I mean, there's if there's a patient complaint before you get that letter, there's a whole other set of things that you can do around talking to the patient, disclosing it to the patient, taking the right records, following up with the patient, trying to address the actual clinical issue. Once you have that complaint, you can talk to it. So remember, you got to honor and respect patient privacy, right? So regardless of whether there's a complaint or not, Try to defeat that defensive, angry reaction, which we all have, right?
Sure.
Because that usually will cloud your judgment. The last thing you want to do is write to the college and saying this patient doesn't know what they're talking about, they're ignorant, they're a liar. And when I worked at the college, I saw a lot of responses like that, and it has the exact opposite.
So you want to be more objective rather than be subjective.
Objective, professional, empathetic, all of those things. You want to argue your case without pointing the finger of blame, right? Mm-hmm. Because the college is there, the regulatory bodies are there to do what? To protect the patient, right? To protect the public interest, not to protect the dentist. And so if they see you as a professional who cares about patients, who cares about all the patients in their practice, who wants to do good work and wants to get good outcomes, they're going to say, okay, this is somebody we can work with. If they see you as somebody who's lashing out, then all of a sudden they're wondering, well, maybe the patient has a point.
Mm-hmm. Interesting.
Yeah.
So, reputational management, can you maybe share a story or two related to online reviews where dentists have gotten upset, what they can do about it, especially if it's an unfounded, let's say, Google review.
Yeah.
Can we get rid of the Google review? Yeah. Can you, what do you recommend? Maybe you can share some stories in your personal experience.
Yeah, I'll share one story. So there was a patient, and this is when I was at the professional liability program, had endodontic treatment. And I think it was on the 2.4. The problem was she was supposed to have endodontic treatment on the 2.5.
Ah, okay.
Okay. So this patient immediately, wrote this review. It was a very negative review. And the dentist reached out to the patient and said, look, I'm so sorry this happened. Here's what we're going to do to make this right. Did the endo on the tooth that needed the treatment that had the pathology. Completed the endo on the tooth that was inadvertently accessed and opened. Waived the fee, obviously, for both. Explained to the patient how this happened. Told the patient what they were going to do to make sure this never happened to anybody else. And, said, I'm really sorry. Just explained, I'm sorry, this was an error. That patient, a couple days later, took down the review, the negative review on Google, and put up the most glowing positive review about this dentist, saying she was caring, she was honest, she was trustworthy, and she was a great clinician.
It's amazing.
And it was honestly the most positive Google review I've ever seen that came out of an error.
So that's possible. So a patient who does a review, they can actually take down their review, and it worked out great for that dentist.
We see it all the time. It doesn't have to be such a major error either. It can be small things, right? Just the clinic was rude. The wait times were too long. They discussed my my private financial situation in front of another patient. You reach out to that patient, you talk to them, you explain what you're going to do, that you're empathetic, you apologize. Often the patient will take down the negative review and sometimes put up a positive one. So that's I think a very good example of realizing that you can always make improvements, right? Just because something happened doesn't mean you can't improve the situation. Another one we've seen, and this is at the flip side, where a patient put up a review saying my treatment didn't go according to plan. This dentist is either rude or doesn't have the appropriate level of skills and training. And we've seen dentists go on and say, look, patient, you don't know what you're talking about. Let me explain the terrible situation your mouth was in when I met you.
Nothing like fanning the fire.
And absolutely. So what that can lead to is that patient's friends then piling on and leaving a bunch of negative reviews, which nobody wants. But I've seen several instances now where the patient files a complaint saying that the dentist violated my privacy, either with the regulatory body or the privacy commissioner.
Interesting.
And we've seen dentists have to pay pretty hefty fines, tens of thousands of dollars in some cases, because of the privacy breach.
Wow.
So that's taking a bad situation and making it worse.
Making it a lot worse. How can dentists, sort of transitioning a little bit, how can dentists protect themselves from accusations of insurance fraud? And what are some of the red flags that might trigger an insurance audit?
Well, there are a number of red flags. I mean, I think the number one thing you can do in almost everything we've discussed, at least clinically and also financially, is have good records. That's the first thing. If there's ever an insurance audit, if you are able to show the diagnosis clearly, the diagnostic imaging that you base the diagnosis off of, if that's relevant, the treatment plan and the procedure that you performed, and why the procedure that you build was the reasonable, medically necessary, the patient consented, and that it was validated by the chart notes, you're never going to have an issue. The insurance companies may ask, they'll go away. The other thing to think of is some people just have individual or unique practices where they have a specific patient demographic, or maybe they receive internal referrals, and so they see certain kinds of patients or certain kinds of procedures more often. Now, in those cases, you may get an insurance audit. So why is that? Because the insurance companies have information about tens of thousands of dentists, right? Millions of patients, and they can see what the typical practice looks like. If you think of like your normal curve, right? You have so many fillings, so many crowns, so many root canals in your average population. Whereas and of those, let's say extractions, for example, X percentage of those extractions would be simple and X percent would be complex, right? So let's say it's 50-50, just for the sake of comparison here. If in your practice you have 95% complicated extractions, they may wonder if you're overbilling or upcharging.
And now with AI, they can do predictive analysis
much faster. So A, they have the data. B, they have the resources and the algorithms where they can spot the outliers. And so they may ask for 10 or 15 charts at first. And if you can show, well, look, we have 3 or 4 dentists in my office. The younger associates do the simple extractions, and all the complex extractions are referred to me. So you are going to see 95%. And then if you could show them with the records, you'll be good. But there's a number of these kinds of procedure code ratios that insurance companies use to identify risk or potential fraud. Endo's another one. If every canal is calcified and you're always using that procedure code, it pays a little bit more. There may be a higher likelihood that you're going to get an audit.
Well, it's an interesting story many years ago. It's a funny story. I won't name names, of course, but there was an insurance audit against a particular practitioner that he was doing too many root canals. And guess what? He was an endodontist.
There you go. Yeah.
So they did mess up on that profile and that auditing.
Yeah, and I think they learn from their mistakes, and I think now like your unique ID with the insurance companies would indicate within your unique ID that you're a specialist, and maybe historically they didn't have that information. But I would say a fair amount of these audits are just sort of check-ins. They're not necessarily targeted. And the ones that are targeted, you have a good chance of not having to pay back any money as long as your records are solid.
So moving forward, how do you see professional liability evolving in dentistry over the next decade?
Well, that's a really good question. I would say the one thing that you hit on earlier was the evolution of AI, right? And so I think the algorithm of spotting potential issues will get better and better from the insurance company's perspective, but also like the malpractice insurance companies are going to be able to predict, maybe certain dentists have higher rates of malpractice. They may change compensation models. There's been some big changes. Alberta changed its structure a few years ago. They did not provide malpractice insurance. And so now that's part of their membership. Other provinces may follow them. In Ontario, the professional liability program is part of the college. It's a department under the RCDSO. And the RCDSO is actually looking at potentially taking the malpractice portion out of the college and potentially selling it to an insurance company to take over and run. And so you may see the actual parties, the people who are involved in providing malpractice insurance changing. Patients continue to get more and more educated. And I think the younger patients are quick to look at Google, Dr. Google, WebMD, and understand, do I really need a crown? Are root canals safe? And come in with more and more opinions on the care that they provide.
Mhm.
And I think professionals are going to have to learn to have those conversations with people who may believe, have some misunderstandings of the treatment, but who also really want to feel like they're part of that conversation. And so those conversations will determine, whether there's liability or not in some cases. And then, with technology, there's a lot of stuff you can't predict. I think more and more dentists will realize that they need to have cyber insurance.
Sure, of course.
Because I think the risk of malpractice and potentially litigation that follows will continue to rise. Those are some of the ways, and some will have to
Well,
see.
we are very fortunate here at Dentalcorp to have you and your team on our side.
Mhm.
It gives us reassurance. Any final advice for our listeners on protecting themselves professionally?
Yeah, I guess my final advice would be two parts. One is to just remember that communication is everything. When you look at why do patients sue and why do they complain, one of the reasons is they want to prevent a similar thing happening to another patient, right? That's one of the common reasons. Another is because they feel like they didn't get enough information about what happened. Another is they felt like, the professional didn't take accountability. And so all of those things, they don't have to do with the clinical care you provided. It's how did you speak to the patient? What did you explain to the patient? And how did you deal with issues after they arose? On that front, there's apology legislation in Ontario and in most provinces where professionals can say, I'm sorry for something that happened, and it can't be used against them, right?
Without really admitting guilt.
Without it, you can't use it as evidence, right? And so just to remember that often sharing all of the objective facts with patients, while you may be scared to, is basically the best way to prevent there from being any kind of complaint later. So communication, soft skills are critical for professional success, and don't underestimate their importance, and do take continuing education on that front. So that would be the first part. The second is record keeping. Once there's a complaint, the official legal document that courts or regulators are going to look at are your records. The better your records are, that is the best insurance policy you can have. It's just have great records. So think about communication. How can you do it better? No matter where you are in your career, you can always improve. Patients are changing, and so you have to change. And then two, always take great records. Challenge, if you work with other dentists, review their records, have them review yours. Do a little in-house peer review the way hospitals do. Make sure your dental assistants are there supporting you, taking good records. If you're overseeing hygienists, make sure they're taking good records. That is the best insurance policy.
That's great. Communication, record keeping. Two main things.
Absolutely.
Julian, you're a gem. Thank you for coming on to Dental Talk. You're a wealth of information and provide a great service, not only to us, but dentistry in general.
Dr. G, you're a gem as well, and thank you for having me on Dental Talk.
Thank you.